We're back here with Dr. Stewart Lonky, pulmonary toxicology expert, to answer your questions on Facebook and Twitter about asthma. First up is Stephanie87. I'm a track runner, and I was wondering if there was anything I can do before I run to limit the possibility of an asthma attack.
I think that, Stephanie, the issue becomes what medicine you're taking now. But I will presume that you may be taking a combination bronchodilator steroid medication twice daily. If you're not, you should be. If you are going to be running track and you're going to be doing this during a training period, you should be on this baseline medication, which is a combination of the bronchodilator and the anti-inflammatory, and it lasts 12 hours. But before you run, you should use an extra dose of just the bronchodilator. Albuterol works, any of the albuterol derivatives, and there are many on the marketplace. We can name some of them, Xopenex and Proventil and Ventolin and so on. Those inhalers, taking 2 quick puffs before you run. Now, if you're not on the long-acting combination, you should still use the beta-2, the bronchodilator, the short-acting one, before you run. It'll last about 2 hours, 2 to 3 hours at the most, and it's effective immediately. It is protective.
Great question and awesome answer. Next is Ruby44. How do you find insurance providers deal with the costs associated with the diagnosis and treatment of asthma? It's a great question.
Well, when it comes to the diagnosis of asthma, most insurance providers deal very well with that. They cover doctors' visits, and the pulmonary function studies I was talking about are fairly commonplace. They've been around 40 years or so. And so the insurance providers cover that test. And in point of fact, in an asthmatic, we like to do that test once a year, once every other year. Certainly, if you're having an acute attack, if you're having increasing symptoms, they will cover a simplified version of the full test every few months. So we can do that in our office, right? And we can tell how much worse things have gotten or if they're getting better. As far as the treatment is concerned, the basic medications are covered. The bronchodilators, the medicines that open the airways, they're covered. The anti-inflammatory medications, the cortisone pills and the cortisone derivative inhalers, they're covered. Now we get into some of the trickier aspects. Those medications used to treat the mucus, some of those are available over the counter. There's a product called Mucinex. If you can't afford Mucinex, plain old Robitussin. Okay, not Robitussin with any letter after it, just plain old Robitussin works wonders in breaking up mucus. But when we start getting into the newer combination medications, the medications that have a combined long-acting bronchodilator and a long-acting anti-inflammatory medication, some insurance providers don't cover that. I find that to be a little bit difficult, and for the people out there, here's something I would suggest that you do. If your doctor is treating you for asthma on a regular basis, and even putting you on cortisone pills, you need to insist to your insurance carrier, through your doctor, that to decrease the chances of side effects from the steroids, you need to be on a long-acting inhaled steroid.
Wow, great advice, great advice. And our last question up is Susie Q. What should I do if someone I'm with or I have an asthma attack?
Wow, that's a good question. Obviously, if you have asthma, Susie, you're carrying your inhaler, and that's, I guess, number one, don't leave home without it. Don't leave home without your bronchodilator. Most of my patients carry bronchodilators. If they're women, they're in their purses. My family members that I know, my brother had asthma for many years. He had it in his car. You need to have a bronchodilator. There are no quick fix-its for an asthma attack. The most important thing you can do on your way to a hospital, an emergency room, your doctor's office, is this. Breathe in slowly, don't panic, and purse your lips like this as you blow out. That back pressure helps open up some airways. It slows down the breath out, and yes, over time you will have more air in your lungs. But when you're having an asthma attack and it's making you feel incredibly nervous, anxious, the worst thing for you is to feel, I don't know what to do and I don't know where to go, because anxiety alone will trigger worsening asthma. And the mechanisms for that have been worked out over the years, but basically those cells become more activated and they start secreting more of those chemicals that cause the spasm.
And Dr. Lonky, we've talked about with other diseases on this program, if you're with someone that you think might be having, let's say, an asthma attack, we always talk about getting help right away, calling 911 if you think someone's having an asthma attack. Would you agree with that advice?
I would definitely agree. I think that the use of, everybody has a cell phone, and calling 911 and getting emergency care there, you know, it may not be a very severe asthma attack and it might not even be asthma, but you know something? Asthma can go bad quickly. And so if you're with somebody and you suspect that that's what's happening, certainly call 911.
Well, it's great advice and something we've heard before. I also want to mention Dr. Lonky is an author of an incredible book called Invisible Killers. Can you actually tell us a little bit about your book, Dr. Lonky?
Well, I would love to. The book Invisible Killers is available, if I could do a plug, at invisiblekillers.com. But what triggered this book was the understanding that we are all being exposed to very low levels of toxins in the atmosphere all the time. And so every one of us is walking around with a toxic burden. There are some 80,000 chemicals in use today in the United States, and fewer than 10% have ever been tested for their effects on humans. So we're exposed to things like hairsprays in women, lipsticks and cleaning agents and fertilizers and things in the air that when the EPA measures their concentration, they're fine. They're safe. They're within the safe limit. The safe limit's 0. That's the real limit that it should be. But the safe limit is that won't kill you today or tomorrow. But your body accumulates those toxins and you store them up. We talked a little bit about this and how it can affect the airways. It can make them more sensitive, which is why we see more asthma. Some of these chemicals in the body accumulate and disturb hormones, such as female hormones, estrogens, and can lead to an increased incidence of breast cancer. Some of those chemicals can develop in the body and affect the pancreas and glucose metabolism. Therefore, we have a higher rate of childhood obesity and diabetes. The book talks a lot about this, and it talks about how we can begin to make a difference and eliminate those toxins from the body.
Wow, outstanding stuff. So Invisible Killers on invisiblekillers.com. Thank you very much, Dr. Stewart Lonky, for joining us today and teaching us all about asthma. Make sure to join us on emPOWERme.tv, MD-VOD, your health, live and on demand.